Most of the time, patients come to see their physician because of symptoms they're having. And one of the most common symptoms patients will come see a physician for is pain. I want to help distinguish between pain that's dangerous and pain that's not. The reason is we're always going to have pain, and pain is not always bad. Pain is something to warn us of problems. If you are exercising and you're not used to exercising, or you're exercising more than you usually do, and the next day you feel achy, you're not going to go see the doctor because of that. That is because of the damage that was done to the muscles in the process of overactivity, and there's inflammation, and all of that is a normal process of the muscle getting stronger. But if you lift something heavy and feel a tear, a searing pain in your shoulder, and that limits your ability to move your arm, you've done damage. Depending on the severity, you may wait a day or two, but if that pain exists, there's a problem. It needs to be evaluated. So pain that's achy is not as important as pain that's searing and sharp. The other type and quality of pain that's concerning is pain that's focused in an area is a lot more concerning than pain that's in a diffuse area. If your shoulder kind of aches and you know that it's some work that you've done, that tells you to rest the arm. If that shoulder has a pinpoint spot where the pain is searing, the more focused the pain, the more concern there is. If you're having generalized abdominal discomfort, maybe you ate too much, maybe it was something you ate that was bad, that's one thing. If the pain starts getting focused around the right lower quadrant, that could mean appendicitis. So the more focused the pain is, the more concern there is. Another thing about pain is whether a pain is worse when you move. Pain that you have in your abdomen that's worse when you move is more likely due to muscles and structures that help support your abdomen, whereas pain in your abdomen that doesn't change when you move is more concerning because it could mean organ pain or something deep within that's much more of a concern. Another value of pain are associated symptoms. If you have a pain in your head and you're getting nauseous and your vision is changing, that's a concern. If you have a pain in your head that goes down your neck, and when you move your head, you could feel the soreness of the muscles at the base of your skull, that's a lot less concerning. That's more of a stress headache or muscle tension. So try to differentiate these types of pain. The other thing that's important is the degree of pain. I ask my patients to tell me, what is your pain like from a scale of 0 to 10? And this is something that's kind of hard to maybe delineate, but it's important for your physician to know. 0 is nothing, 10 is the worst pain you can imagine. When we have a lot of pain, we think it's an 8 or a 9. To give you an idea, there's a scale of how your face looks with different types of pain. And this is something where if your pain is severe, you're sweating and you're grimacing and it's just hard you feel restless. If the pain is moderate, you're not happy, but you can live with it as long as it doesn't stay that way. And if the pain causes you, it's not that bad, you know it's kind of minor.